As a 43-year-old Black woman, I have an intimate understanding of how it feels not to be believed by your healthcare provider. Hi, my name is Joy Altimare, and I'm Chief Engagement and Brand Officer at EHE Health. This is a word about how when equitable and holistic healthcare is available to communities of color, we all benefit. I think in this country, we've seen specific issues around healthcare and people of color from the beginning of time. There's definitely what we call lack of awareness around how people of color feel, how they feel emotionally and physically, but also what they're coming to the table with. This perspective that we're all the same is common, I think, with the healthcare industry. And it's rooted in really the history of how the healthcare industry has disregarded people of color. We look at things like the Tuskegee syphilis experiment. They were without knowledge and without permission, monitoring groups of people who had syphilis and telling them they were giving them something to help them with it, but really they were letting it run rampant. And that disregard for human life, that disregard for community, for the Black community, I think is part of this trust and part of the dissatisfaction that most people of color have with the healthcare. When we think about women like Henrietta Lacks, who died at 31, and the issue there is that she was going in because she felt something was wrong, and they were, again, without permission and without even transparency, taking pieces of her cervix for testing and for other reasons. That is the shared history this country has around healthcare and people of color. Moments in time where people are being told that the healthcare industry is doing something to save them or to make them feel better, but really the reality is that they're going behind the scenes and they're actually, again, without permission, taking pieces of people's body. We should be able to provide access from womb to tomb to every human being, yet we don't. And we think about why that exists. Obviously, it's rooted in racism, sexism, it's rooted in all of these things that have plagued our country since its beginning. COVID has really highlighted the inequalities that exist in healthcare, but they didn't start today. The inequalities in healthcare began many, many, many years ago, and what we're feeling is the effect of ignoring those inequalities and not coming up with policies to combat them. Today, we see, over 217,000 Americans have died from COVID. And when we look at that information, we know that African Americans are dying at 2 to 3 times more than their white counterparts. Why is that? COVID is a very nasty disease that it really attacks those with 1, 2, 3 risk factors. If you have diabetes, if you have chronic heart disease, and you catch COVID, the likelihood of you surviving is much lower than a healthier human being or a healthier American. So after listening to all this, and especially, it can sound very dire, is there hope for the future? And I say yes, a resounding yes. Why? Because first of all, we know that people are talking about it more and more. The fact that it's on everyone's radar, the fact that we are bringing a heightened awareness to the inequalities that exist in healthcare and how they have had dire effects on people of color. The fact that we're talking about it so proudly, so openly is step number 1. But more importantly, step number 2, we will move into action. We see small companies, large companies, we see nonprofit companies really coming together to join their voices and talk about and demand policy change. Many people of color, especially across the country, have had an experience where they felt they weren't heard or listened to. When you can gather together and share that experience, then you can gather together and strategize and amplify your voices to those who can make policy change. We should be focused really on understanding the policies that are going to be put into place that will help or hurt us for generations to come. My hope is that people are using this time to educate themselves as they go into the healthcare system. They're becoming advocates for themselves. They're demanding that their employers provide ample, not only access, but options, and that they're really using their dollars as their voice to say, I will or will not participate in something that doesn't take care of me holistically, that doesn't think of my family as an important part of the American culture. If they can do that, then the future will be bright.